Hey guys, and welcome back. Now we're going to talk about the anatomy of the urinary bladder. So I drew this picture before recording to save some time. So the bladder is basically a pyramidal shaped structure that has an apex that faces your abdominal wall. So your abdominal wall is basically here. And then it is having surfaces. It has a superior surface that is facing your abdominal cavity above, and you have lateral surfaces that is facing your lateral pelvic walls. You have a posterior base, all right, and it has an inferior angle or the base, which has the prostate in male. Okay, so basically it's a pyramidal shaped structure. It has superior surface, lateral surfaces, posterior surface, and a base. And the apex is anteriorly, and this is the anterior angle, and it has an inferior angle. Now, attached to the apex is the median umbilical ligament, and that is going to be explained into more details with the abdominal wall video in the digestive module. But this is basically, this ligament was the urachus, and that was to remove the waste products from the fetus. And that was the communication between the fetus and the mother. And after birth, it got obliterated, forming what we call the median umbilical ligament. All right. Now, in the postero-superior angles of the bladder, the ureters open. All right, so in the posterior superior angles, remember this is the posterior superior angles. Okay, the ureters open into the urinary bladder at that angle, and here we will have the running of the urine from the ureters to the urinary bladder. Okay, now it's important to know the relations of the urinary bladder. So if you have your bladder here in the pelvis, you guys know that you have the peritoneal reflection comes on top of the urinary bladder and reflects back into the abdominal cavity, and it comes up. So basically the peritoneal cavity comes on top of it and it comes back. And the urinary bladder is considered to be a subperitoneal organ. In case of female, because the peritoneum comes all the way and it reflects on the uterus and it reflects back on the urinary bladder and it comes up, it's going to create a pouch. And that pouch is what we call the uterovesical pouch. And in male, we call it the rectovesical pouch. We don't have utero here. And now regarding the relations of the urinary bladder, because the uterus sleeps on top of the bladder, the superior relation of the urinary bladder in female is going to be very easy and simple. It's going to be just the uterus, because the uterus separates the bladder from everything in the abdominal cavity. However, in male, it is related to the coils of small intestine and the sigmoid colon. So basically on top of the urinary bladder you will have coils and the colon coming in superior relation. In the posterior relation, it's going to also be simple and easy because the vagina is the continuation down from the uterus, so it's basically only vagina. However, in male, the posterior relation of the urinary bladder is going to be the seminal vesicles, the ampulla of vas deferens. The vas deferens comes from the back, comes from the inguinal region all the way to the back of the bladder, and it becomes dilated, forming the ampulla. And then the rest of the story, I don't want to talk about the male system, it's already explained in that playlist, but just the ampulla of vas deferens is a posterior relation, and also the ampulla of rectum is posterior relation to the urinary bladder in male. So you get to see the seminal vesicle, the vas deferens, the rectum, posterior relations. However, in the female, the whole story of the female system separates the bladder from everything else. So the superior relation would be uterus, posterior relation would be vagina. That's all. And here you have the male stuff, and superiorly abdominal stuff. Okay, now what about the anterior relation? It's gonna be your pubic bone and pubic symphysis. It's very simple and easy. However, in the lateral surfaces, remember that you are here in the pelvis, all right? So what's going to be lateral to you is the lateral pelvic wall. What was the lateral pelvic wall? It's basically your obturator internus muscle. Obturator internus muscle is a lateral relation to the bladder, and down to that you have part of the levator ani muscle. Levator ani should make the floor of the pelvis, and this is a very important muscle to support the pelvic structures. But it's not only a floor, it also comes laterally. So lateral to the bladder, you have the obturator internus muscle and you have the levator ani muscle. And of course, this is obturator internus muscle and this is obturator foramen. And from here, the obturator nerval vessels will exit the pelvis. So definitely lateral relation to the bladder would be stuff related to the obturator, which is the obturator nerve and vessels. All right, so the urinary bladder lateral relations would be the obturator internus muscle, obturator nerve and vessels, and the levator ani muscle. And if you guys look at this very nice cadaveric picture, you will see that the bladder in female, it is superior relation would be the uterus and posterior relation would be the vagina. And in male, if you look at this is the bladder and how the ureters are opening in the posterior-superior angles of the bladder. And if you look at the posterior, it's going to be a male stuff. And this is basically your seminal vesicle. And it's going to be the ampulla of vas deferens. So the vas deferens will come here. Okay, the vas deferens will come here, and then the seminal vesicle will have a duct. Both of them will open together into ejaculatory duct to empty the content, the semen that came from the testis here, and the seminal fluid came from the seminal vesicle here. They will unite together to open into the prostatic urethra, and from here you will take them all the way outside through the penile and out of the body. And that is the whole system is explained again in the male reproductive system of the reproductive system module playlist. All right, so here you can see the posterior relations, and this is also that can show you how the lateral pelvic wall would be the lateral relations of your bladder, which is basically obturator internus muscle, and on top of it you have the obturator nerve and vessels and part of the levator ani, all right, which is basically the floor of your pelvis is going to also be lateral relations. And then we call them infralateral surfaces because this is lateral but it's facing inferiorly, all right? Now, moving on to the internal structure of the bladder. So you guys have your urinary bladder inside. And if you look at the urinary bladder inside, you will find an elevated part of the mucosal lining. Because in your viscera, you know that you have a mucosal layer, and that mucosal layer is basically your epithelial layer supported by lamina propria or connective tissue. And so this is basically your mucosal layer, and this is endoderm. So basically here we have an elevated area here, and this is basically how the mucosal fold is folded above the intramural part of ureter. Because remember, the ureter, as it comes all the way to the urinary bladder, it runs within the thickness of the urinary bladder. Around 2 centimeters are running here, and this is what is making the sphincter. And it's very important because with the contraction of the bladder, you're gonna seal off or you're gonna close off the ureters so that there will no we will prevent the backflow of the urine back into the ureters. So with the contraction of the detrusor muscle that is in the muscular wall of the bladder, it's very important to know that the ureters is running within the thickness, and that is helping with the contraction of the muscle to prevent the backflow of the ureter. And because of the running of this part, we have an elevation on the mucosal fold, and this is what makes what we call the ureteric fold. And in between the two ureteric folds, we have what we call the interureteric ridge, which is also an elevated part in the mucosal lining of the urinary bladder. And with trying to draw a triangle between the opening of two ureteric orifices and the start of the urethra here, you will have a trigone, and that trigone is important because this is the area where you will have rich innervation, and this is a mesodermal area that is rich in innervation, the trigone of the bladder, which is going to give you the sensation that the bladder has been filled, and it's time now to empty the bladder, and that's going to give the feedback about the filling of the bladder with the rich innervation in this area. And coming down to the prostate, we have a lot of important information here in the prostatic urethra, and that is explained in good deal of details in the male reproductive system video part 2 concept 3. So you guys can go ahead and watch that video. This is how it looks like from outside in the reproductive system module, to understand more about the prostatic urethra, and all these information is mentioned there. Now, if we try to take a section of the wall of the bladder and look under the microscope, you guys know that all our organs are lined by epithelium from inside facing the lumen of the organ, and that epithelial lining is followed by a supportive connective tissue, and that would be followed by a muscle layer, which is also supported and covered by connective tissue outside. So what type of epithelium is the urinary bladder? It's the transitional epithelium. And why is it as transitional? Because it undergoes a transition. If it's fully distended and it's filled with urine, it's going to be distended that way. So it's going to be stretched. It's going to be flattened. The topmost layer will be flattened. However, if it's empty, you will find that the top cells are umbrella-like and they are puffier, and that means that this bladder is empty. The cells are relaxed and they are taking bigger space as they want, because nothing is compressing them, and because the epithelial topmost cells is based on that, what we give the name of the epithelium, and because that is changing, undergoes a transition, we call it transitional epithelium. Okay, and those closely packed cells, which is the epithelial lining, is followed by connective tissue, which is lamina propria. Whenever we have a connective tissue that is supporting an epithelium, we call it lamina propria, because it supports, because the nutrition comes in here. All right, the blood vessels are here. It connects them to the next muscular layer, which is the submucosa. Submucosa is a connective tissue, and then you have the muscularis. The muscularis, we don't have it in this picture, but it's just basically muscle layers, and this muscularis is going to be your detrusor muscle. The detrusor muscle is important because contraction of this muscle will help you to empty the bladder from the urine. Okay, so we were going to talk about the filling of the bladder and emptying of the bladder as we proceed. And of course, back to this, we have smooth muscles within the wall of the bladder, and this is what we call the internal urethral sphincter. And this is autonomically innervated. It's not under our control. It's under sympathetic and parasympathetic. It's under the reflex feedback mechanism that comes to the spinal cord, and it comes back based on the filling state of the urine inside the bladder. So it's not under our control. However, we have external urethral sphincter, which is a skeletal muscle innervated by somatic nerve. So the innervation of the external urethral sphincter is the pudendal nerve, S2 to S4, and the internal urethral sphincter is innervated by autonomic nerves. So this is involuntarily controlled, and the external urethral sphincter is voluntarily controlled, and we're going to talk about that in a while. Now, what is the blood supply of the bladder? It's very simple to know the blood supply, because you guys know that we have okay, so my pencil is not working. All right, so you have the as you have your abdominal aorta coming in, it will start to bifurcate into common iliacs, right and left. The common iliac will give you internal and external iliacs. So this is the common iliac, this is the abdominal aorta, this is the common iliac. Common iliac will give you external that will exit, internal will get into the pelvis. So the internal iliac is the artery of the pelvic viscera. From the internal iliac, we will have a branch that comes to the superior part of the bladder, and you will have a branch that comes to the inferior. I'm pointing at correct ones, but at the right side, and this is in the left side, and here they have removed the lateral wall of the pelvis, so you can see that the superior vesicle is an artery of the internal iliac. So here we have internal iliac, anterior division and posterior division. So the internal iliac will give you, anterior division will give you superior vesicle, and it will give you inferior vesicle. So these are the two blood vessels that supply the urinary bladder. All right. Now, what would be the innervation of a urinary bladder? The innervation is basically done by the hypogastric plexus. So you guys, we have something called superior hypogastric plexus, and we have something called inferior hypogastric plexus. The superior hypogastric plexus is formed, it's basically formed by sympathetic nerves at the level of around T7 to L1. These sympathetic nerves, you guys know that sympathetic nerves come out of the thoracolumbar spinal cord segments. That's why I'm saying T7 to L1. These are thoracolumbar segments that are forming superior hypogastric plexus. To be more specific from where exactly they are coming from the aortic plexus and lumbar portion of the sympathetic trunk. So we have from these two, the aortic plexus, intermesenteric plexus, and the lumbar portion of a sympathetic trunk, they will form something called superior hypogastric plexus. Plexus means a group of fusion of nerves, okay? Superior hypogastric plexus is basically sympathetic, but it will receive parasympathetic. We're going to talk about that in a while. Once we form the superior hypogastric plexus from T7 to L1, we will have two nerves coming out of them, right and left hypogastric nerves. These two nerves will carry sympathetic innervation all the way down to form the inferior hypogastric plexus. The inferior hypogastric plexus will have sympathetic from these two nerves, and it will also receive from pelvic splenic neck nerves, the blue ones. Pelvic splenic neck nerves are parasympathetic nerves. They are coming from S2 to S4. And because you guys know that the craniosacral outflow is what gives us the parasympathetic innervation, S2 to S4 lateral columns of the spinal cord will give me parasympathetic nerves. Once the parasympathetic nerves will come from S2 to S4, pelvic splenic neck nerves, it will go, that will form the inferior hypogastric plexus. So the inferior hypogastric plexus is a mixed nerve. It has sympathetic innervation from right and left hypogastric nerves, which are coming from the superior hypogastric plexus, and it has parasympathetic nerves coming from the pelvic splenic neck nerves. Once I form the green, in this picture, the green inferior hypogastric plexus, I have now a plexus that has sympathetic and parasympathetic, and I'm ready to go ahead and supply the pelvic viscera sympathetically and parasympathetically. All right. Now, from the same nerves, the right and left hypogastric nerves, we will get some parasympathetic nerves coming back to the superior hypogastric plexus. So that way, even the superior hypogastric plexus will receive parasympathetic nerves from S2 to S4. All right? So this is the idea of the superior hypogastric plexus and inferior hypogastric plexus. Why we're mentioning that? Because we need to know that in the pelvic organs, the pelvic organs are receiving sympathetic innervation from superior hypogastric plexus, which is basically bringing its nerves, sympathetic nerves, from the aortic plexus and lumbar, which is basically from T7 to L1. And that is bringing a sympathetic by right and left hypogastric nerves to the inferior. And the inferior, after receiving from the pelvic splanchnic nerves, parasympathetic, it will become green here in color, which I like this picture because it shows you that the pelvic splanchnic nerves are mixed autonomic nerves. They have from the blue ones, the pelvic, parasympathetic, S2 to S4, and it has from the yellow ones, from the superior hypogastric plexus, it has sympathetic innervation. So that way we will have pelvic splanchnic nerves that will supply the bladder and even more structures that are explained in the genital system, okay, and the pelvis. So this is a summary for you guys to know that from here you're getting your innervation. To be more specific, in some sources they will tell you the urinary bladder is getting it from T11 to L1, and in some sources from T7. I've read T7 somewhere to L1. So here I wrote it's T11 to L1, probably from one of the sources, and to know that the superior hypogastric plexus sympathetic innervation is coming from the aortic plexus and lumbar splanchnic nerves, and it also receives from the pelvic splanchnic nerves parasympathetic innervation. Okay, so the sympathetic innervation that is trying to reach the inferior, that is going to be by the right and left hypogastric nerves, like I showed you in the picture. And the inferior will also get from the parasympathetic pelvic splanchnic nerves, S2 to S4, and from here you will get the innervation to the urinary bladder. All right, and what would be the somatic innervation? It's the pudendal nerve. Pudendal is a somatic nerve. It comes out of S2 to S4, but remember guys, if I told you somatic, it means this is the motor route. Unfortunately, my pencil is not working. I could have drawn to you the spinal cord segment and showed you that this is the sensory route and this is the motor. Okay, so the motor from the anterior horn cells, it means this is the motor somatic. But if I'm getting from the lateral horn, this is autonomic. Okay, so just make sure to understand the difference between the pelvic splanchnic nerves, which is S2 to S4, and the pudendal, which is also S2 to S4, but this is somatic and that is autonomic from the lateral horn, and this is from the anterior horn. Okay, now what happens in the urinary bladder when we are filling the bladder? So once you're filling the bladder with urine, it keeps on filling, and once the bladder is filled with the with the urine, it will become stretched. And stretching of the bladder wall will activate the stretch receptors, and that is gonna get to the spinal cord, sending signals to by spinal reflex to the spinal cord level. Once you get that activated in the spinal cord level, you will have parasympathetic neural flow, and the parasympathetic innervation will cause contraction, because remember, sympathetic fight or flight, parasympathetic rest and digest, and of course urination. Anything that doesn't need fight or flight mode, it means you are into relaxation, urination, everything. So once parasympathetic is activated, it will cause contraction of the detrosal muscles, contraction of the detrosal muscle will help you because you want to empty. Now the bladder is filled, and now parasympathetic is active. You want to empty the bladder, so you will ask that detrosor to contract itself because you want to empty it, and you will ask also the internal urethral sphincter to get relaxed because you also want to empty the bladder. However, if this is the correct time and you're ready to go to the bathroom and urinate, you will also ask the external urethral sphincter to relax. So somatic control will cause relaxation of external sphincter to ask the whole pathway to open up and let the urine come out. However, if this is not the correct time to urinate, with your control, the pudendal nerve will contract the external urethral sphincter to ask the this part of the urethra to get closed off, because this is not the correct time. But I will still get the signal that I want to urinate. The trouser is contracting, internal urethral sphincter is open, and I want to urinate, but this is not the right time, so the external urethral sphincter is going to be closed off. Whenever it's the right time, by my control, I will relax it, and I will ask it to open up and let everything get out of the bladder. Okay, so this is the idea. In order to voiding, in order for urination, you need to have parasympathetic innervation to contract the trouser, to relax the internal urethral sphincter, and ask the somatic motor control to relax this. But if you're not ready, you're not going to respond to that signal. All right? There is, okay, let's show you this picture, and then I will get back to the pain. So this is also a very nice picture to show you guys how we fill, store, and void in the bladder. So you're going to have your bladder filled with urine. You're going to get a parasympathetic activation once it's filled, because you want to ask the detrusor muscle to contract. You also want to ask the internal urethral sphincter to relax. And then with your voluntary control, if it's the right time to urinate, you're going to relax the external urethral sphincter to urinate. However, if not, this is not the correct time, you will contract the external urethral sphincter. And this is how we will, how the sympathetic and parasympathetic are doing its function. The sympathetic innervation, of course, you know that the parasympathetic is your pelvic splanchnic neck nerves, S2 to S4, and the sympathetic is your hypogastric nerves, right and left, from the superior hypogastric plexus, like I explained previously. And the sympathetic is going to do the opposite. It's going to inhibit the detrusor during the filling. It contracts the muscles in the urethra and the bladder neck. Everything here will be contracted, because you don't want the urine to come out of the bladder, because you are not ready to urinate. You are just filling the bladder. Okay? So just the opposite to what we've just said, it's going to be the sympathetic. All right? Getting back to the pain fibers, you guys, we have something called pelvic pain line. Pelvic pain line is basically a line that starts at a mid-sigmoid point. And that means the structures that are coming in contact with peritoneum above the pelvic pain line, they will, whenever there is a pain in that viscera, it will be following the sympathetic neural pathway, neural flow. Superior S sympathetic, superior to the pelvic pain line. Below the pelvic pain line, it's going to be by parasympathetic. And because your urinary bladder is below the pelvic pain line, so if you have a pain fibers, autonomic pain, that is going to be following the parasympathetic fibers it's going to be following the parasympathetic fibers. Okay, so if they ask you in a question, the pain fibers of the urinary bladder is following which nerves, you're going to say the parasympathetic nerves, S2 to S4 pelvic splanchnic neck nerves. And above that, which is in the abdominal viscera, before the mid-sigmoid point, it's going to be by sympathetic, and after this mid-sigmoid point, it's going to be parasympathetic, and that is explained in the digestive module. So just make sure that you know that the pain fibers in urinary bladder is following the parasympathetic nerves, which is the pelvic splanchnic neck nerves, S2 to S4. Right, so thank you guys for watching. I hope you grasped all the basics of the urinary system, and see you in the next